If you struggle to set boundaries, if you're a people pleaser, if you don't know how to say no, then this video is for you. Today we're going to be covering assertiveness training, which is a kind of psychotherapeutic technique used by therapists all around the world. It's actually probably the third most common reason outside of anxiety and depression that people come to therapy. So I'm going to share with you how assertiveness training works, what it says about how to become more assertive, and then also how you can use assertiveness training for yourself. Okay. I'm a clinical psychologist. My name is Nevern. Nice to meet you. And let's jump into it with the case of Melissa. So tell me if you can relate to this story as I read it out to you guys. You're welcome to read along here as well. But this is what Melissa had to say after going through assertiveness training. A year ago and many years before that, I would have spent much more time in internal conflict, overwhelming feelings of guilt, shame, and self-doubt. I'd say yes when inside I was screaming no. It was the right thing to do, after all. I'm a nice person. That means you just say yes, no matter what. And the apologizing, sorry became a standard comment in my interaction with others. A year ago, much of my interactions with others were fraught with anxiety and guilt. Things are thankfully different now. No apologies, no hesitation, well, very limited hesitation. No, I'm sorry. No, my apologies. No fake smiling while I secretly resent what I've agreed to. No guilt for having the courage, conviction, and strength to express my thoughts or say no. If you can relate to Melissa's struggles, or if you're inspired by the progress that she's made, then you definitely need to check out this technique that Melissa went through. So let's jump into what assertiveness training is, and let's see how you can start developing it for yourself. So as you can see on the slide, assertiveness training is an evidence-based psychotherapeutic technique that helps people openly verbalize what they want from various life situations. So let's break this definition down a bit because I think it's important to have the solid grounding before we go into the specific techniques of how you can get to where Melissa has got. So the first part there, an evidence-based technique. This means that it's been shown through science to have helped people with that exact problem. It's not enough to just have someone's opinion about what you need to do if you're not assertive. We have to look at what's been tested, what's been shown through studies, through people sitting down, training people with this technique, and then seeing what were the actual results. So it's evidence-based. It's a psychotherapeutic technique. So that means I use it in therapy. I mean, I think just this past week, I've probably done some assertiveness training in about with 3 different clients. So it's quite commonly used. But it's used in therapy. Now, for the purposes of this video, you're going to have to think about how to use this for yourself without me, which I'll guide you through. I've sort of developed the slides in a way where you can become your own therapist related to assertiveness training. The next part I want to highlight there is openly. It helps people openly verbalize what they want from life. So the openly part is important because it means with confidence. It means without feeling anxious, without feeling guilty. And that's the end goal. That's where you can get with assertiveness training. You can get to a space where, like Melissa, you openly and non-apologetically explain what you need from different situations. That doesn't mean being narcissistic. That doesn't mean being demanding or unfair to those around you. It just means being confident within your own knowledge of what you need and what's fair for you. Okay, so openly. And then at the end there, it says various life situations because assertiveness training applies at home, it applies at work, it applies in the context of a couple, it applies in the context of family, of friends, it applies even in during hobbies or social events. Assertiveness training is pretty much everywhere because we're so social. Okay. Assertiveness at home can look like saying, I am uncomfortable cooking dinner and doing the dishes. So I would appreciate if you could help me with one of those and I'll take care of the other. Assertiveness at work can look like, since you increased my workload, I've not had the subsequent pay raise to go with the increased tasks. And I think it would be worthwhile discussing how we can make that a bit more fair. So assertiveness applies in many life domains. Now that we've got that definition out of the way, I'd like you to take a look at the two main components of assertiveness training. It's very important to start here because assertiveness training stands on two legs, and you need, according to the research that was in this article that I showed at the beginning of the slideshow, according to the research, you need both of these legs to stand, to be balanced. You can't have just one of these components and not the other. So what are the components? The first one is dealing with the anxiety and really any other emotions that get in the way of assertiveness. That is the first port of call. It doesn't matter who you're doing assertiveness training with. Usually there are some emotions that are causing that block to the person being assertive. So it's very important to be able to address those blocks, to be able to say, it seems like it is the anxiety or the guilt that's showing up in these moments that's causing you to withdraw and not be as assertive as you could be. So that's very important. And then the second leg of assertiveness training is teaching the practical skills to be assertive. And toward the end of the slideshow, we're going to go through some of those practical skills, things like being able to communicate, being able to know how to phrase your boundaries, learning how to say no in a respectful way. These are all skills that can actually be developed. So, if you think about these two legs, you can have the skills like being able to communicate, but struggle to set the boundary because it's scary to set a boundary. So even though maybe you're verbally intact, maybe you're articulate in every other area of your life, you're able to communicate very clearly, but because there's anxiety related to a specific situation, because that leg is wobbly, your assertiveness is going to fall flat. And then if we flip it around, sometimes you might not have the anxiety and you go for it, but you come off as aggressive or unfair because you don't have the proper skills or ways of phrasing these things. So think about for yourself, which of these two legs you struggle with more and which one you need to address more. Do you need to get rid of the emotions that are getting in the way, or do you need some practical skills, some know-how, okay, I'm willing to do it and the emotions aren't a problem, but how exactly do I do this? And then once you've thought about it for yourself, I'd like you to pay attention, maybe pay more attention to the areas where you're struggling as we go through both of these and unpack both of these. So the next slide deals with that first leg, which is dealing with anxiety. How can you identify and restructure the thinking that is causing the anxiety? That's a very important, or I shouldn't say important, that's a very useful way to be able to address the anxiety. Because usually if we feel anxious about something, it means that there are certain underlying beliefs or ways of thinking about the situation that is leading to the anxiety. For example, your underlying belief might be, and as I give you these underlying beliefs, just notice if any of these apply to you. One underlying belief that you might have is, I will hurt someone, right? So you have that belief, I will hurt someone if I set a boundary or if I'm assertive. I'll come off as sharp or abrasive and their feelings will be hurt. If you have that belief, that's probably going to cause anxiety around setting boundaries, and that's going to stop you from being assertive. So, you may hurt someone, but a useful counter belief to this belief is that someone is already being hurt, right? That person is you. By not setting boundaries, someone is being hurt, and you are feeling that hurt on a daily basis because people aren't living up to your expectations and they don't know what you need. So that's a very important component of assertiveness training, is identifying these underlying beliefs that are causing the anxiety and then addressing those beliefs, seeing if they're true, seeing if they're useful. Another one is, I will be rejected if I set a boundary. If you are rejected by a partner for setting a boundary or being assertive, then you want to know who those people are that will reject you for wanting fair treatment. You want to know that. Even though it's difficult to be rejected, even though it hurts to be rejected, you actually, in a way, you want to set these boundaries early on in your relationships so that you can actually see who are the people that will have a problem with you demanding fair treatment, and who are the people who actually respect that and are okay with that, because you want to surround yourself with the latter. Now you don't always get to choose who you surround yourself with, but either way, it's very useful to know who will reject you for wanting fair treatment. Another underlying belief is that confrontation is dangerous. So, if that's you, if you feel a lack of safety whenever there's some sort of conflict or confrontation, and it just feels dangerous to you, it's very useful to think about where that comes from. And also if it's worth the cost of not setting a boundary. Maybe you feel so unsafe setting a boundary, and confrontation feels so dangerous that maybe it's not worth it setting the boundary because it'll cause you that much distress. But usually it causes distress just in that moment that you're setting the boundary, and maybe you feel a bit guilty afterwards. But then in the long term, your life shapes up and rounds out to more of the kind of life that you would want to live in the long term. So even if it is punishing and confrontation feels unsafe in the moment, think about what will be good for you in the long term. That's usually a better frame of mind to have. And then I'll end with this belief before we move on to the next slide, which is people will view me differently if I set a boundary. You're going to be seen differently, and the way people perceive you and the impression you leave on people is important to you. Now, in terms of this belief, I want to say yes, people will see you differently, but that's the point. You want people to see you differently because it's actually the current way in which they're seeing you is not serving you. So that's actually a belief that I think is okay to have, and one that actually needs to be accepted, is that people will view you differently. And that's the point. You want them to view you as someone who is honest, confident, and can't be taken advantage of. And if that's not how they currently view you, then that needs to change. Okay. There are many more beliefs that we could look into, but these are just a few of them that I commonly see in my practice. So here's a helpful thought related to this first leg of boundary setting in terms of the emotions is, do you want assertive people around you? Think about that for a moment. Do you want people who communicate with you openly and honestly? Do you want people who make their needs known? Do you want people for whom you know where you stand with them? And if the answer is yes, then you can use this perspective-taking exercise to know that then it's okay for you to be assertive. It's okay for you to set boundaries. Because if you want people who are open with you in their communication, who tell you how they're feeling, who tell you where you stand with them, if you want people who are clear about what they need from you, then you want assertive people around you, and then use that to reassure yourself that it's okay for you to also be that person, not just for everyone else to be that person. So think about if you've ever had that person who doesn't communicate their needs, and you only find out later that they were disappointed with you for not fulfilling some expectation that they didn't even mention to you. And so they slowly grew resentful over time, and the relationship actually suffered for that because of the fact that they didn't communicate, because of the fact that they weren't assertive. We all sort of know people who are like that. Maybe we're like that as well. And so just realize that usually isn't helpful to the relationship. So use the thought of, if you're struggling to be assertive, and if you feel bad about being assertive, use the thought that, you know what, I would actually want assertive people around me to comfort you in your pursuit of assertiveness. Another thing that's useful here in terms of the emotions that get in the way and that block you is exploring your early experiences. Where did you learn to not be assertive? Where did these patterns of behavior come from? Because there is a reason. There's a reason that you struggle with assertiveness. And usually it's with parents who are always imposing their own views and preferences and judgments on their children. And so the child grows up in a context where they're used to having their boundaries violated. And they're used to being with a caregiver who takes control and doesn't actually check in with the child and respect the child's boundaries. Sometimes the early childhood experience that leads to someone struggling with assertiveness is if you were always praised for going with the flow, if you were always praised for your lack of boundaries, then eventually you learn, oh, okay, that's how I get some positive regard from my caregivers. So that's what I'll keep doing then. I'll keep going with the flow. I'll construct my identity around being easygoing and not being difficult. And then that way I'll get love and acceptance from those around me. So, these are just some possibilities. But if any of these possibilities are you, just acknowledge that. Just acknowledge where these patterns come from. Now, the question you might have in your mind at this stage is why? What's the point of going into the past, digging these things up? Well, the first thing is that it allows you to give yourself empathy. Because sometimes we beat ourselves up about not being assertive and we say, oh, I'm so unassertive. And then we pile on the self-criticism. But exploring your childhood experience actually allows you to see that, hold on, there's actually a reason why I struggle with this. So I'm not willfully trying to sabotage myself here. I'm actually someone who has struggled with this for a long time because of my origins, and there's some empathy then to be had for me. Okay, because I didn't know any better. I was just a child who grew up with these patterns ingrained into them, and I didn't have much choice in that. So it allows for empathy. It allows you to be patient with yourself as well, because if you explore your early experiences and you realize that this is an old pattern, you won't be trying to put the pressure on to solve this by tomorrow, because in my experience as a clinician, you are not going to solve this by tomorrow. Definitely not. Probably not even in a week, probably not even in a month. These things usually take months of work and working at these things. If you're lucky, and sometimes it can take years, and that's okay. What's a few years working on something as important as being assertive, in the grand scheme of your whole life, of decades. So it's a worthwhile journey, and exploring these early experiences helps you realize, oh, okay, this has been around for 20 years, so I'm not going to just turn this over in a night. And just being patient with yourself will ease the process. It'll make it a journey rather than something that you just have to, a switch that has to be flipped. And then it also allows you, exploring these early relationships allows you to rank different relationships in terms of difficulty level with setting boundaries, because you are going to struggle the most to set boundaries in the relationships where your lack of assertiveness started. So if you're partly unassertive because you've had an overbearing mother, for example, that is where you will struggle the most to be assertive. That's the if you're playing a video game, that's the boss fight. So that's useful to know, because it allows you to then try to be assertive in relationships where it's a bit easier and there's not as much deep entrenched history of you being unassertive. And then you can work your way up to those more difficult relationships. So, and you'll only know what those relationships are where you struggle the most to be assertive if you also explore these early experiences, which is why I have this slide up. Okay, so the next aspect in terms of dealing with these emotional blocks is understanding if these emotional blocks occur in any context or if they are specific to specific contexts. And so you need to ask yourself, and you can do that now, is there a specific area in my life where I struggle to be assertive? I've had clients in my practice. I had one specifically who came to me because she struggled to be assertive at home with her partner. And the more we discussed her work and her occupation and the way she runs things, she was actually very assertive. She had good boundaries. She was able to say no. And when I brought that up, she realized, hang on, it's actually unfair for me to call myself unassertive, because I do have the capacity to be assertive, meaning she has the skills, that second leg of assertiveness, but it's the anxiety that's showing up specifically in the context of her romantic relationships. That's where she struggles to be assertive. And maybe that's you, or maybe you know someone like that who, they're an absolute boss at work, and then when it comes to issues of the heart and romance, they struggle to set boundaries there, and they give in to their partner a lot, even though you know that they're a lot more assertive than that outside of that context. So you see, with her, I couldn't just throw skills at her. I couldn't tell her, oh, okay, if you're unassertive, let's give you these skills and scripts to be assertive, because she already knew how to do that. So for her, we had to think about, why is it in your romantic relationships that you're struggling to be assertive? And we eventually got to some conclusion there, and we worked on that specific situation for her. So think about the specifics for you. Maybe you have the opposite. Maybe you're the person who's super assertive at home, but at work you feel afraid. At work it feels risky because, oh, they're my boss, or I have a difficult boss, and there could be consequences if I'm assertive at work, and there are no consequences at home. So do this for yourself. Explore every context. Explore romantic relationships, friendships, family relationships. Explore your work life. Explore what your boundaries are like with strangers. Explore the context of having just met someone. Don't leave any stone unturned here. And then the more you do this, the more context you explore, the richer your understanding of where these emotions arise, of anxiety and guilt over being assertive. You'll start to realize where those emotions arrive specifically, because then you can address those contexts specifically for you. And then it's important to accept that this journey is going to come with emotional difficulty. There will be fear, there'll be guilt, there'll be shame, there'll be hopelessness, but you have to say to yourself that I'm going to do this anyways. Because the first step of boundary setting is saying, I'm going to set the boundary even though I feel these difficult emotions, and I'm going to go through this discomfort. Because on the other end of that process is being able to now do the boundaries and set them so intuitively that you no longer are burdened by these negative emotions. It's just a habit. You're in the habit of feeling guilty after being assertive, or feeling ashamed about setting boundaries, or feeling anxious when you do it, or unsafe. It's just a habit, but the more you do it, the more you will feel comfortable with that process. Sometimes avoidance of emotions means you can't approach assertiveness. So maybe for the longest of time, instead of prioritizing approaching assertiveness, you've been prioritizing avoiding emotions. And what I'm telling you is to flip that. I'm telling you to approach those negative feelings so that you don't avoid assertiveness. Because sometimes avoiding negative emotions is very costly in terms of getting to what we want. Sometimes these things are a package deal. If you want the assertiveness, if you want to be assertive, you also have to be willing to lean into difficult negative emotions. I mean, I used to be afraid of public speaking. And when I was in school, I would feel very shy and nervous about having to give a speech. In primary school, when you have to, it's like English, and you have to write a speech and then read it out to the class. I struggled with that a lot. But the more I did it, and every time it was okay and there was no major consequence or catastrophe, I learned that it was safe. And over time, my anxiety started to drop off. And today, where I am now is I feel a bit of anxiety before giving a public lecture or something like that, but most of my life revolves around speaking, and it's okay. I don't feel how I felt back then because I've done it repetitively. You need to allow yourself to do it repetitively until those feelings slowly start to disappear. So everything I've spoken about thus far has been with dealing with the emotions, and specifically the anxiety around being assertive. So once you've assessed these emotions, you know what comes up for you in terms of these blocks, you've checked your beliefs, you've looked at the context in which you struggle with this, and you've explored your childhood experiences, you then need the specifics on how to set boundaries. You need some skills, some social skills training. Something as simple as setting a boundary, having a phrase that is helpful can help. For example, I remember when I heard the phrase, "I would appreciate if dot dot dot." I that was like a breakthrough for me in terms of my own boundaries, because up to then I struggled to understanding how to say things like, "I need you to do this for me," or "I expect this," or I demand this. That all sounded very abrasive. So learning the phrase, having the skill, for example, to say, "I would appreciate if you could do XYZ," that felt a lot better to me. So there are many, many things, many skills that you can learn that will help you communicate more assertively and be more assertive in your life. So let's get into the specifics of what those skills are. You get things like learning verbal scripts. You get modeling assertive role models. You get rehearsing the assertiveness in real time. And you can also record yourself. So let's go through each of these ones a bit. And I want you to think for yourself as I'm reading through them, if there are any of these in particular that might be helpful for you. And then, really challenge yourself to learn more about this. There's lots of resources online. I'll also try and, expand on this further. But remember, this is just an introduction to assertiveness training and how to get started with it. So an example of learning a verbal script, that first behavioral skill there is you can use something called Dear Man, for example. Dear Man is an acronym. So each letter stands for something specific, and it's from dialectical behavior therapy, and it's a way to set a boundary. It gives you a script, because within the acronym, if we run through it quickly, the D stands for describing what boundary was violated. The E stands for expressing how you felt when that boundary was violated. The A stands for being asserting what you need, so saying how you would have liked things to go. The R stands for reinforcing when someone respects your boundary. So, for example, if you've described, expressed, and asserted, and then someone says okay and abides and respects that boundary, you need to reinforce them. So you need to reward them. You need to say thank you, or you need to get them a gift, or just let them know that you acknowledge that they respected your boundary. So that R in Dear is very important, because a lot of people don't do that. They just put the demand out without giving the reward. But it's in giving the reward that people become more enthusiastic about respecting your boundaries. And then the MAN are just things to keep in mind in the moment. So M stands for being mindful while setting that boundary. The A stands for appearing confident. And then the N stands for negotiating, being open to negotiating. If you say you need the person to do this and they say, okay, I can't do quite that, but I can do this, then, being a bit flexible with that and negotiating that boundary so that both of you can abide by it. I think the next thing there is modeling assertive role models. And here's something useful that you can do is think about people who you look up to and who you respect, who actually embody assertiveness. The reason this is helpful is because you can then try to model their behavior. You can try to analyze, how do they communicate? What sort of words do they use? How do they appear in terms of their confidence and their posture, the way that they present themselves? And once you do that, you'll be able to feel more confident in setting your boundaries, because you'll learn some practical skills by analyzing their behavior. But you'll also be reminded that this is someone I respect and someone I look up to, and hey, look, they're assertive and everything's okay. So it helps reduce the anxiety, and it helps to give you skills. It addresses both legs. Think about who your assertive role models are. I know for me, someone like Barack Obama, I know is very good at being able to set boundaries and be assertive in a very well-rounded, compassionate, and sophisticated way. So I look to the way that he communicates his boundaries, and that helps me. So think about who it is for you. Now, the next thing there is rehearsing. Rehearsing is once you know what boundary needs to be set, you've looked at the context where you struggle and you decide, I'm going to use the Dear Man script in the specific context. You can rehearse setting that boundary. Usually I do this with my clients. I just the other day had a client who they needed to set a boundary with a friend. And so I said, okay, you imagine that I'm the friend and you give me the boundary, and then I'll give you some feedback. I'll let you know how I found that, how it sat with me, what your how confident you appeared, the way that the words landed with me. And they did that, and we went back and forth, and I slowly helped them refine their boundary so that they appeared more confident, so that they were mindful, so that they were fair, so that they used good words. So even though you are not in the therapeutic context, you can still do this for yourself by recording yourself, for example. And that's where that last point on the slide comes in. So instead of having me, the therapist, there, set up a camera or record yourself on your phone and then play that back and look at what that looks like for you. You'll be surprised at how good you are at correcting your own assertive behavior, because you know what assertiveness looks like in other people, but it's just hard to gauge that when you're the one speaking and you can't see yourself. So recording yourself and playing that back and then trying it again and recording yourself means that you can replace me with a camera and become your own therapist related to assertiveness. So those are some of the skills training that you could use, and that forms part of the second leg of assertiveness. But there are many other skills. You can look into things like interpersonal effectiveness within dialectical behavior therapy, for example, or you can Google assertiveness training, and you can Google boundary setting scripts. There are tons of resources online. So I hope this lecture helps you know where to go to deepen your understanding of how to be assertive. Now, look, there are many other ways to become your own therapist. And even if you do become an assertive person, you can still struggle with depression, anxiety, insomnia, whatever else. And if that's you, I'd recommend checking out the other lectures that I have within this playlist. Maybe it's just what you need.